Hello, and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Kate Favaro. Kate is the outreach coordinator with Hospice of the St. Lawrence Valley. She's here today to talk to us about an educational series called Hospice Myth Busters that she'll be running in the next few weeks. Kate, welcome to North Country Matters. It is a pleasure to have you with me to talk about these important myths and misconceptions about hospice so we can get things clear in people's mind.
Yeah, thank you so much for having me. Any opportunity I get to talk about the myths and get the truth out there, I will take.
All right, so the truth is out there, and you will be telling us all about it. So let's start, Kate, by asking you to tell us a little bit about yourself and how you came to be working at hospice. What does being the outreach coordinator entail?
So I did not grow up thinking I was going to work at hospice, but I had a personal experience back in 2019 that opened my eyes to the beauty of hospice care and what it actually looks like. So when I had the opportunity to join the Hospice of St. Lawrence Valley team, I took it. I started here 4 years ago as the bereavement coordinator, so providing one-on-one grief support to our hospice family members after our patients have died. And then I transitioned into the outreach role that I have now. So the crux of what I do is to normalize conversations around death and dying and end of life planning and make it a little less scary to bring them up with your family.
And that's really important. Anybody, and including my family, who's had the opportunity to work with hospice, it makes such a huge difference towards, when a person's coming to our end of life, and that support that your organization gives really helps not only the patient but the family through that transition. So that's a great service that you provide. So, very briefly, Kate, just give us a quick overview of what it is the Hospice of the St. Lawrence Valley does.
So, hospice has served the residents of St. Lawrence County for over 40 years now. We are a five-star hospice, which means that we have survey results from actual hospice families that have recommended and given us 5 stars in the terms of service we provide. Hospice care itself is provided with an interdisciplinary team. So, every patient's going to get a nurse, a home health aide, a social worker, a spiritual care coordinator, and then after the patient has died, the family will maintain a relationship with the bereavement coordinator for support afterwards. So we do that. There's also another piece to hospice, which is the community stuff. So we are unique in that we work in the school district. So if there's a death in a local school district or a local school community, I will respond. I'm really there to support the admin and kind of remind the admin they know what the plan is. We do that, and then we do continuing education each year for the school counselors. So there's a lot to what we do.
There is a lot to what you do, and you mentioned, particularly when there is a death in a school community, that is always a tight-knit community, and knowing how to respond and having that outreach is so important to help the students, the staff through that process. So thanks for that as well. So, as you know, talking about end of life care can often be difficult. And we know that there are a lot of misconceptions in people's minds about what it is that hospice does. What are some of the most common myths that you get asked about on a routine basis?
So I hear a lot that hospice is only for people who have cancer, and that's not true. Hospice is for anyone who has 6 months or less to live if the disease runs its normal course. So your disease process can be anything. It certainly doesn't just have to be cancer, but a lot of people I think get stuck on the cancer bit. It's definitely not just for people who have cancer. The other one that we hear pretty frequently is that if you're on hospice, you can't leave your house. Also not true. People on hospice can go to the casino, they can win the jackpot, they can do anything they want. It's just when you get to the point where you do need to stay home, that's kind of when we're there to really help your family and you make that decision. A lot of different myths. Those are the first two that come to mind.
I think one of the other ones that people think about oftentimes is the healthcare provider, your own personal doctor. You, as you mentioned, you have hospice doctors, you have spiritual advisors, you have nurses, and all the rest of it. But you don't have to give up your doctor, do you?
No, no, absolutely. A lot of people, especially in the North Country, have had the same primary care provider for decades. We don't expect you to give up a relationship like that to come onto hospice. If your doctor is willing to follow you onto hospice, they certainly can. You don't have to leave that provider behind at all.
So that's going to be a lot of comfort to people to know that that relationship that, as you mentioned, can have be years in the making is still going to be there. So when a patient is on hospice care, Kate, there's another whole set of myths that we need to clarify for people. Let's talk about some of those in terms of what people think versus what the reality is.
Yes. So I think people think that when you sign on to hospice, A, you have to stay home all the time, but B, you have to have someone with you 24/7. And that's not true. We need to know that you have a plan for when you need someone to stay with you 24/7. For my grandma, if we had tried to put somebody in with her 24/7, that would not have gone over well. But we knew the plan when she did need that. So we work with our families to really make sure that they understand that we maintain independence as long as possible. We just really help them make a plan for when they need it. The other pretty big myth that I continue to hear is that Hospice of St. Lawrence Valley has a hospice house. So while we would love to have that, the administrative building that's right between Potsdam and Canton is not a hospice house. So we provide hospice care to patients in their home environments, which is really unique and I think impactful because you don't have to get out of your home. You can be in your home surrounded by your loved ones. Your pets are there. It's wonderful. So we don't have a hospice house, but we will come and provide service in your home, which leads to the other super common myth that hospice just moves in and stays with you 24/7. Our hospice was founded in 1986. And while they used to provide services like that, we don't anymore. So you'll see your nurse about once a week, sometimes more often. You'll see your social worker and your spiritual care coordinator pretty regularly, but we're not moving in and staying with you.
And that's really an important point because your organization is not big enough. You couldn't afford to do that kind of stuff, even if that was something that you wanted to do. And for those places that do actually have a hospice house, so to speak, it's a very different operation than the kind of operation you are able to provide, isn't it?
Yeah, yeah, it is. We do have a hospice house. The Hospice of Jefferson County does have a hospice house down in Watertown. So that's a relatively local option, but we're just in homes.
Yes, and of course, one of the things that we know is that if we can keep people in their own homes, they do better, they're more comfortable, and it's certainly less expensive all the way around because having someone in a nursing home or in long-term assisted care is very, very expensive. And so if you can stay at home, not only do you feel better emotionally and physically, but it's a whole lot less of a burden on your family, isn't it?
Absolutely. Yeah.
So I think one of the confusing things about hospice is how it is paid for. Let's give people some key information about that aspect. When you go on hospice, what happens next?
So when you come onto hospice, if you have Medicare, so if you are over the age of 65 and you opt for hospice, Medicare's hospice benefit will kick in. And that is going to cover everything that's related to your hospice diagnosis. So all of your medications will come under the hospice benefit, all of the nursing assessments that you're getting every week, the social work, the spiritual care, all of that is going to be covered with this benefit. That benefit also ensures that your family has access to the grief support for up to 13 months after you've passed. So everything is going to be covered. If you are younger than 65 and you don't have Medicare, I'm I'm not 65 and I have intentionally looked in my insurance plan to confirm that hospice is covered. It is. And it honestly is covered basically the same way. Most major insurances are going to cover hospice the same way that Medicare would. As long as it's related to your terminal condition, it's going to be covered. If for whatever reason something wasn't covered, your case manager can work with you to find a way to cover something. We also pick up the tab for all the DME. So if you need a wheelchair, if you need an over-the-bed table, if you need a hospital bed, we coordinate all of that, pay for it all. You're never going to get a bill from us. We do work pretty frequently with populations that don't have any type of insurance. And that's just something that we know that they need access to, so we don't bill for anything like that either.
That is such an important point because that the financial burdens that can come with that really play a major role in depression and anxiety for patients and their families. And so, if that burden is not there, it makes dealing with the person's care, which is already traumatic enough, much easier, doesn't it?
Yes, absolutely. I know for me when my grandma was on service, that was one of the first questions was like, can we afford this?
Mhm.
This seems like a lot of really great care, which she needs and deserves, but it seems very expensive. But thankfully, Medicare, the hospice benefit picks it up. And even if your own insurance doesn't or you're uninsured, you're not going to get a bill from us.
No, and I think you make a very good point about checking your insurance policy just to see what it does cover, because there are ways to plan ahead, but not if you don't know what your policy is going to cover. So I think that's a great suggestion on your part to do that. I know another thing that we personally have, we bought long-term care a long time ago because we were concerned about ending up possibly in a nursing home, which, as you know, is about $140,000 a year out of pocket if you're not super wealthy or you're poverty stricken. That's a tremendous burden. So whenever we end up paying that premium, we kind of snicker to ourselves and say, well, I hope we never need it, but boy, if we do, it's going to save a ton of anxiety down the road. So something to think about.
Absolutely.
So, the thing about end of life care is that it means, of course, the end is coming for the hospice patient. So let's talk about what that means and how hospice can ease the process for families, not only for the patient, but for all the caregivers and the survivors who are really in a very difficult situation emotionally, aren't they?
Yeah, yeah, absolutely. It's a hard time for the patient, it's a hard time for the family. And I think the first facet to that is when is the time, right? Like when do we call hospice? Um, it is better to call us sooner rather than later. If you give us a call because your provider has said if your disease runs its normal course, you have about 6 months left, and our physician looks at that and says, that seems to track. We also agree with that. You can come to us. If our physician looks at stuff and it seems a little too early, we'll tell you that, but you can always give us a call again. So the sooner the better. When you're coming onto hospice, it's end of life, and people think that that just means you're going to die the next day. Sometimes that happens. Can't lie to you about that. Sometimes it does happen, but the longer that we have you and your family on service, the more we can do. Like in 5 days, we can do a lot. We can get a social worker in, we can get spiritual care in, we can get DME in, we can get you with a nurse. But in 5 weeks, you'll have all of that and a relationship with the people that are in your home taking care of you. So that I think is really helpful for people. Really, the longer the better. The other thing in terms of like when to call hospice and myths around end of life, right, is that hospice kills people. We're not in the business of killing people. We are in the business of making sure that people have a safe and comfortable death at home. So hospice does not kill people. That's a pretty prevalent myth. But I wouldn't look great in orange. We're not out here killing people. Like it's not our situation. And that's certainly a conversation we have with the community a lot. And if people have more questions about that, they can certainly call and we'll walk them through it.
And I think you make a good point about calling sooner rather than later, because if you call too late, then oftentimes if it's so close to the person's death, it does seem like hospice comes in and the person dies. You can see where in people's minds that might be the linkage. But what you're really talking about is giving the patient and the family more quality of life for the length of time the person has, and also relieving a lot of the stress and burden off the family, because being a full-time caregiver is about as discouraging a process as it can be, isn't it?
Yes, it is. It is a full-time job, and a lot of times it feels like a thankless job, and it's just so easy to get burned out. And when people talk about end of life, I think they think just about the physical dying process, which is important, and we need to learn about it. because when you're taking care of someone who's dying, you don't know what's normal and what's not. You've never been through this yourself.
Mhm.
But there's more to it than the physical aspects. So we work with our caregivers to educate them on the physicality, but also on the emotions that are going to come up for the patient as well as the caregiver. We work with the caregiver to really drive home the need to take a break. We have volunteers that will go out and sit with our patients so our caregivers can just take a break, go walk the dog, take a nap, just sit in your car, just get out of the house for a little bit. So our caregivers do amazing work. And having been a caregiver, it's hard. It's hard. We love these people. We want to be there for them. Hospice teaches you how to truly be there for them, not just physically, but also emotionally.
And that's an important point, I think, because um, if the caregiver burns out, everybody loses, including the patient. And so self-care is something that's very hard to give. And if you can be trained better about what to expect and say it's okay to get discouraged, it's okay to get exhausted, it's okay to be emotionally down, but take a break. And we'll
Mhm.
help you get through that process. So I think that part of it is hugely important. And we don't talk enough about the burden of caregiving, I think, as a society. And yet we know that probably one out of every four persons today, right now, is giving care. It might be to an infant or a young child, it might be to an elderly family member, it may be helping out a community friend. But it's a lot of work.
Absolutely. Caregivers are everywhere. I do know that our friends at Office for the Aging have a caregiver support group that people definitely could contact them about and learn more. Caregiving is not something that we're always prepared to take on the mantle of, but it is something that once you have the support around you, you can do effectively.
Yes, and you make a great point about the Office of the Aging, who has a huge number of resources that help people as they age and so that they can stay in their own home. They may not have a physical ailment that is going to kill them next week, but they still need help to be able to stay in their own home, and that is always the best placement. So thanks for that reminder about the good work those folks are doing. So finally, Kate, let's talk about the resources that a hospice has to help families once the patient has died. The family is not left on their own with their grief, are they?
No, absolutely not. So I did start, like I said, as the bereavement coordinator. And it was a little intimidating when I first started because I'm picking up the phone and I'm calling the primary caregivers of the patients after the death. I learned very quickly never to ask how they were doing. It was always, how are you adjusting? Because
Hmm.
you don't know how you're doing. I didn't know how I was doing. So it's not just the patient is gone and now your whole support system is gone. The patient is gone, but we're going to call and check in with you. We offer support in the hospice bereavement um, program in three different ways, basically. So I'd get a couple different standard responses when I would call. The first would be, I'm fine. Thank you so much for checking. I will give you a call if I need anything. The second was always, I'm fine. I don't need anything. And then they start crying and they talk to me for an hour, which is perfect. That's what we want, right? The third would be like, I really don't want to talk to you at all, and just an abrupt end, which is all emotions and grief are valid. So that's okay. If our people are bereaved people are wanting to talk, I used to make appointments with them. The current bereavement coordinator will make appointments with them. Usually those last about an hour. And that conversation ranges anywhere from, is this normal that I feel kind of relieved, to I don't know how to cook dinner for myself because my wife of 63 years cooked dinner every night and I've eaten nothing but cereal for the last 8 weeks. So we talk about everything from emotions to the concreteness of, I didn't think about that. Um, the other thing that we do that I think is really helpful, especially for people who are instrumental grievers. So, instrumental grievers are people that don't benefit from talking about their feelings. They're the people that kind of want to step back and learn about what they're going through and see how they connect with other people's experiences. So, to meet those people where they're at, we provide every 3 months newsletters that kind of tracks where they might be in the grief process. It just gives some background on like these feelings are normal, or this is how we cope with things, or if there are people in your family who are grieving a little bit different, that's okay. Just giving that education piece that we don't usually have going into grief. And that gives my instrumental grievers a tool that I don't think a lot of them anticipate, but a lot of them benefit from.
Right. I was talking with a friend of mine not too long ago, and she lost her first husband to cancer quite a number of years ago. And she told me how important hospice had been to her, not only during the process of losing her husband, to him when he died, but she said for the next 13 months, hospice was there for her for the grief counseling. So there's no timeline for that support, is there? It takes as long as it takes.
It does. It takes as long as it takes. And honestly, statistically, 90% of people who suffer a loss are going to manage their grief just fine. That's what we love to see. We love that they have the ability, but there have been times where I've gotten phone calls and it's maybe coming up on a year that the person
Mhm.
has been gone and the bereaved person is overwhelmed with the acute grief. So like the intense emotion that they kind of thought that they had already worked through, but it's back because it's that time of year again, and they just need someone to talk to validate that, like, is it normal that I'm this upset again? It is, but we don't talk about it. So when it hits you, you have no idea if it's normal.
No, and I think there are a lot of calendar triggers like that people don't have any idea that it's going to hit them uh a year later, exactly on the day, because that's what you're thinking about. So yeah, those kind of triggers, and to have somebody that you have established that relationship with through the grief process, you can call up and just have somebody kind of hold your hand as you walk through that emotion is so important.
It
So
is. And honestly, our caregivers, the grief trigger on the calendar, it is that year coming up. There's a lot of trepidation around that specific date. But what our caregivers tend to forget about is that they were living in crisis mode from diagnosis till that person passed. So when it's coming up, even a couple weeks before the actual anniversary, your body's remembering living in that state, right? So it makes perfect sense grief-wise that you're coming up on a year, but also your body knows and remembers that stress. So
And you make a great point, because stress does have physical manifestations. It takes a long time for that stress to leave the body, and there's no way that it isn't going to sometimes be triggered by something else. And so, and again, understanding stress is a big part of what your folks do for families, isn't it? Because stress is hard to see from the inside looking out, but it's much easier to see when you're on the outside. So that's a great point. So, Kate, you're going to be doing a series of 8 workshops in the county to talk about all these things and to answer people's more specific questions about hospice. So, tell us about the workshops, how people can find out more, and in general, the important educational work that hospice does every day, because
yeah,
you guys always have something going on.
we do. Um, the Hospice Myth Busters 8 workshops are coming up. They start next week, if I have my calendar right. Yes, they do. They'll start next week. We're going to hit the 4 congregate dining sites with Office for the Aging. We work very, very closely with them. They have a plethora of resources, and even if you're not sure if they're the right people to call, they will tell you the right people to call if it's not them. They're fantastic. So we are going to hit those 4 congregate dining sites. I know those locations are all listed on the Office for the Aging website. And then we're also doing quite a few community-based ones. We're starting down in Clifton Fine. I'm very much looking forward to this drive in this weather. It's going to be gorgeous. And really just trying to educate on here's what we hear in the community, here's why it's true, or here's why it's not true, right? Like, we don't want people not calling because they're afraid, because they don't know a lot. I know I feel much more comfortable asking questions if I kind of know what's happening, but people with hospice, it's already stressful. It's already a scary phone call to make. But if you can have some foundational knowledge going in, that's really helpful. So we are going to cover the myths that we talked about here. We're also going to talk a lot about what happens after the person dies, because one of the benefits to hospice is that if a person dies at home on hospice, it's not considered an unattended death. You just call hospice. You don't have to involve the police. It's a much simpler and honestly a little calmer process. So there are benefits that I think a lot of people just don't even stop to think about. I know before I worked here, I had no idea about that. So we're gonna address the big myths, we're gonna address the little myths. And honestly, I'm really looking forward to hearing the community and what other myths that they've heard. Because I've tagged a lot of them and I've put a lot of them into the presentation, but I'm always interested to hear what the community narrative is.
Well, that is going to be such a valuable resource, and the fact that you're going to where people are is a good thing. And just like being on North Country Matters, now people have seen your face, they've listened to you talk about this. They're going to feel more comfortable when they pick up that phone call and say, "I need to talk to Kate."
Yes,
So,
I
I
hope so.
think that's a good demystifier of the process when you have a face and a voice that you are already familiar with. So, uh, Kate, thank you for coming in. Thank you for all the work that you do and all your colleagues at Hospice do. This is actually going to be the start of a series of programs we're going to be doing in the next year on North Country Matters, talking about the services of hospice and how people can access them, because I don't care who you are, at some point you're going to need to talk to somebody.
Mhm.
And so let's make this as easy a process for people as we can and give them as much advanced information so that they too can recognize, you know what, I need to call.
Yeah, absolutely. That is our goal.
All right. Well, thanks again for coming in, Kate. I'm looking forward to working with you and some of your colleagues as we do more exploration of the wonderful work that hospice does. And we'll be back in touch.
All right, thank you.
You're welcome. So, these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.